starting off bouting in the #1 position today. We've got Taylor Rose. He's joining us again from the Big Sky Medical Center to address direct questions as to the medical center and what's going on there. So Taylor, thank you for coming back and being here today.
Thank you.
I guess we can jump right into it. Any meaningful updates to really report to the community on since we talked last week in terms of the medical center or the county?
Yeah, right now, just a quick update on the COVID situation that's happening in the state. Montana, as of the latest numbers I saw, had 319 confirmed cases, and Gallatin County had 118 confirmed cases, which kind of just goes to show that we are the hot spot in the state. We're acting as such. We're trying to be extra cautious with social distancing and just taking those extra precautions. The health system is preparing for major surges. We're actively running our incident command and making sure that we are addressing all potential scenarios of what could happen with this pandemic. Currently, there's only 2 hospitalized COVID patients in the county, and so that's the current update of the state of the situation in the county right now. The hospital is currently here in Big Sky Medical Center. We opened a viral triage clinic this week, and that's for any patient that's presenting to the hospital seeking care. They'll be referred to that part of the building where they'll be specifically treated for viral symptoms. That kind of keeps us differentiated between sick and not sick people that are coming to seek care when it comes to the COVID virus. Visitor restrictions do remain in place. We are not allowing visitors except in specific circumstances, and drive-through testing for our COVID is up and running, and if you have an order from a doctor or any kind of provider for a COVID test, you can come through and they'll just take your swab in the car. You don't even have to get out of your car for that. It protects us and it protects you and it protects everybody on the campus. We continue to encourage people to use our drive-through pharmacy. You call ahead and you get your prescriptions delivered to you. We're working hard to increase our capacity in the hospital. We're in a construction project to build out some additional rooms. We're also looking to bring in additional testing capabilities, not only the Big Sky Medical Center, but the entire system. We anticipate that we'll have a new testing machine within the next few weeks on site that we'll be able to test for COVID here locally. So that's currently the situation with COVID here in Big Sky, and yeah.
Well, I appreciate that. That was a very detailed update, so thank you for that. I know that a lot of people keep asking about trying to understand case numbers as it relates to Big Sky versus the county, and obviously the health department is not allowing that. They're keeping everything grouped. I think, is there any indications that you can at least give people from Big Sky to understand, or are we seeing increases in Big Sky, or is there any sort of percentage increase in terms of visits or numbers of tests being done, or anything that you can give someone an indication of what's happening here in Big Sky?
Yeah, as you mentioned, the health department is, they're asking that we let them communicate the cases. They do own that part of it from their aspect. So we're letting them communicate where the cases are being done. I will say that we are seeing, the normal route that this disease is taking in other locations we're seeing here, where we don't feel overwhelmed right now, but we are preparing for more. So we're seeing more, and as the health department has said, we have community-acquired transmission, which means that it's just in our community now. It's part of the disease, flora and fauna that's out there, and we just want to make sure that we're practicing the social distancing, hand hygiene, really taking serious what the CDC recommends. We want people to be out and about and get the recreation they need, but when you go to trails, make sure to keep those 6 feet social distancing protocols in place and look for less traffic trails and just maintain those distances that they're asking.
Excellent. It looks like, one of probably the best kind of websites that's tracking this is this IHME website in terms of doing nationwide predictions and such. And it seems that Montana so far is kind of trending below where the predictions were. Is there any science that you guys have been able to place to this, or is this kind of following? Are you guys agreeing with what we're seeing, that we seem to be doing a little bit better than what they predicted?
I would hope that we're doing better than predicted. You know, we're hearing that, you know, social distancing is working. Keep doing it. Don't give up now. There's a recommendation from the CDC to wear masks, but that doesn't negate the importance of social distancing. People, when you need to go out, wear the masks but still practice that social distancing. I will say that the system is working actively to estimate and use predictive modeling to really figure out where we're at on the curve. I don't have an answer for you on where we're at on that yet, but we are working to actively understand this at a local level.
Okay. Beyond the social distancing and you know, kind of the standard protocols, do you have any needs or requests of the community at this stage?
No, just, you know, follow the guidelines, and if you need help, we're here for you. We want to be here for you, and reach out, call us if you have any questions on if you should or shouldn't come, and we'd be more than happy to direct you.
Excellent. You mentioned a little bit about the room construction. Can you give us an update on that? And then also in regards to the new ventilators that were purchased through that Big Sky Relief program?
Yep, so thank you to the Big Sky Relief and all of our community partners. We've been able to quickly, I've never seen a project go this fast, build out 4 additional inpatient beds. That, to give you an idea, is going to double the capacity of our hospital. Those funds will allow us to do this where we would not have been able to, and we're estimating early May to have those rooms constructed. We need to equip them still, but everything's going on track as it should be, and we're expecting good things from those rooms. Excellent. And then the ventilators as well, we're working to get those here on site, and hopefully within the next few weeks, as you understand, the demand for that nationally is pretty high. So we're working hard to get those.
All right. And then in regards to any other PPE equipment, you guys, I mean, do you have what you need right now? Are there any needs out there? Do you need people out there with sewing machines or anything going on?
Yeah. And I'm sure Ben Christensen from SIMS will touch on this later if he's able to talk, but we are looking for innovative ways to utilize and reduce PPE and also reach out to our community partners. SIMS has been a great partner in that. They've sewn us some gowns that are reusable, that are washable, that are completely in compliance with everything we need from an infection control standpoint. So the community has really stepped up. We've had a lot of people reach out to us, provide us with resources, and we're forwarding that on to our incident command, looking and evaluating on how we can best leverage these resources that are being thrown at us. And we're very grateful to everybody's involvement and support in this. And we're just trying to, you know, arrange it all so it works out and follows the infection prevention protocols that we have.
Excellent. Joe, is anything that has come in or anything you'd like to follow up with before we let Taylor get back to his day job? Looks like Joe might be muted. So,
I got you.
All right.
Yep.
Hey Taylor, thank you for coming aboard and coming back on to speak with us. I just wanted to ask you, a couple of questions, but first, how's your staff and the doctors holding up?
They're incredibly resilient. We've asked a lot of them through the last few weeks, and a lot of it revolves around training and preparation. Our patient volumes, they're not outrageous. They're relatively low, like as we'd see in any shoulder season. But we've asked a lot of them to learn new processes, change the way they're doing things, and change habits. And, they've been great. They've taken, the call to action, and they've really been doing a lot of hard work to make sure that they're best prepared to address the needs when we do have those COVID patients come in. We're able to care for them, reduce the risk of their transmitting the COVID disease to the healthcare workers here. And just, I can't say enough good things about the frontline workers that you guys have taking care of you. They're about as good as I've ever seen.
Gotcha. Thank you. I got to tell you, Taylor, we've been getting just a number of questions, a lot of calls, a lot of emails, text messages, a lot of people asking this question. I understand, you mentioned Gallatin County Health Department has jurisdiction for positive COVID patients outside Big Sky Medical Center, and is not discussing specific locations of individuals within the county due to HIPAA regulations. Can you touch on some of the reasons, just for the audience and everyone here, of why this info is not being disseminated, and is there a public right to know information about what town cases are located in?
That is a good question and a hard question to ask, because everybody wants to know. Everybody wants to know, are they at risk? And is the person, that I'm interacting with going to give me this disease or, what have you? But I honestly, the health department has their policies and procedures and why they do things. We're just following their recommendations and treating, this situation in the best way possible. I will say that there is community transmission in Big Sky Medical Center, as I said before, which means there's people walking around here that have COVID-19 that will never show up to our facility because they never are sick enough, and you can never know who those people are going to be. So us informing the public of we have this patient or we don't have this patient is not the best use of how to teach people how to live with this in their community. It is here, it's out there. If you treat everybody like they may be a carrier of COVID, you're going to be much better off than knowing if it's your neighbor or not, or if it's, somebody that I don't know. You may get this false sense of security thinking, oh, it's only one person that, is tested positive, or it's 100 people that have tested positive here in Big Sky. There's these false senses of security that can happen because that's only a small percentage of the people that probably actually have the disease and are walking around with it day to day.
Sure. Well, thanks for that. Just one last question. You mentioned Gallatin County currently having 118 cases. According to the state's response map tracking COVID-19 in Montana, the next highest county in terms of positive cases is Yellowstone with 40. I was just curious, in your opinion, what are some of the reasons that Gallatin County numbers are so much higher compared with the rest of the state?
That is a good question. I am not an epidemiologist or pretend to be, but I think it's kind of the things we already know. We're a touristy county, and there's been a lot of in and out, and it just is. It's in our community. It probably hit here sooner. We have a lot of workers from a lot of different areas. It's just the dynamics of what's going on, and it kind of just goes to show that the policies out there that got us the tourists that we had, that our community thrives on. There's stuff that comes along with that, and that could be partially to blame for this. So.
Mm-hmm. Well, look, thanks so much, Taylor. I really appreciate your time. Eric will send it back to you.
Thanks, guys.
Excellent. Taylor, thank you once again. Please thank the team over there and keep us informed if there are any needs. I know there's a lot of people in Big Sky that are ready to roll up their sleeves and help, and we're grateful for everything the team's doing over there.
Yep, thank you, everyone.